Good evening, everyone, and thank you for joining us for the I Have a Voice Caregiver Advocacy Series. This is the third of 4 conversations in this series, which have been taking place every other Wednesday at 7 p.m. right here on Facebook. My name is Olivya Wilson, and I am the Trauma-Informed Parent Engagement Coordinator at Greater Richmond SCAN. I have the pleasure of introducing the host of this series, Tamika Daniel, who is the Behavioral Health Community Organizer for Greater Richmond SCAN, as well as her 2 special guests, Natalie Clavon-Carter and Lisa Wright. Natalie Clavon-Carter, LPC, is the Clinical Supervisor for Greater Richmond SCAN's Family Support Program. In this role, Natalie balances direct and administrative work. She conducts intake assessments, sees individual parenting clients, and facilitates court-mandated parent groups while supervising parent and children group facilitators and providing ongoing program evaluation and development. Natalie is also the Executive Senior Leader for Greater Richmond SCAN's PCIT, which stands for Parent-Child Interaction Therapy Cohort, and co-chair of the Inclusion and Equity Committee. Natalie is a licensed professional counselor with 8+ years of clinical experience, including residential substance abuse treatment, community-based clinical services, outpatient therapy and private practice, crisis stabilization, and crisis intervention. In her role as a counselor, she provides trauma-informed outpatient therapy for teens and adults, depression, anxiety, parenting, relationships, and phase of life concerns. Lisa Wright is the Richmond Child Advocacy Center, also known as the CAC coordinator. Lisa received her master's degree in social work from VCU in 1993. She is a licensed clinical social worker, registered play therapist, supervisor, and certified therapist in trauma-focused cognitive behavioral therapy. She has devoted her career to providing individual, group, and family therapy for children, adolescents, and adults in outpatient mental health centers. Lisa has specialized training and experience in treating trauma, sexual abuse, and sexual behavior problems. Lisa uses expressive therapies in her work, including play art and sand tray. She is also the mother of 2 beautiful kids. We are so glad to welcome Natalie and Lisa with us today. I am so glad to be joining you all for today's conversation topic, advocacy and mental health. Tamika, I'm going to toss it to you for the rest of this introduction.
Thank you, Olivia. Thank you, Lisa and Natalie, for agreeing to join us. Mental health is a topic that is very near and dear to my heart. Where I come from, speaking on mental health is kind of frowned upon, but it wasn't until I started to take care of my mental health that I was able to start to reach my full potential and see what I was capable of. So I just want to thank you guys, and you guys are in for a treat this evening, and I'm going to toss it back to Olivia so we can get this started.
Sounds good. All right, so I thought it might be helpful to start this conversation off by kind of setting the conversation in an understanding of what mental health is. And so just wanted to, offer the question, what is mental health, or how do you define or describe mental health? And I would open that up to anyone who would like to share.
So I can go first. I think it's sort of a broader definition. I think of mental health as emotional, psychological, and social well-being. So all of the above, and all of those things can impact how we think, feel, and behave. So for kids, for adults, for all across the developmental stages, that's how I would define mental health.
I think Lisa summed that up nicely. If I was going to put it in layman's terms, I would say mental health is just the health of the mind. And the state of your mind affects how you feel emotionally, how you relate to others socially, and just your overall level of functioning.
That is really helpful. Thank you. I think that's helpful to really kind of set this conversation with having that understanding of what mental health is. we titled this whole series, Caregiver Advocacy Series, with the hope that we would empower caregivers to advocate, not just for themselves, but on behalf of their children. And so when we thought about this mental health conversation, we wanted to be able to have a conversation with caregivers, if you will, to kind of offer them some support, some additional information, resources, and again, just some empowerment of how they can go about navigating mental health systems, especially as it relates to their children or children in their care. And so with that in mind, when we think about mental health services or support for youth, what are some different types of mental health services that exist for youth?
So in terms of mental health, help can be offered at 3 different levels. There's community-based, where services are offered in the home. And in terms of youth, that would look like intensive in-home counseling. Then there's also inpatient, which is for more severe cases, youth that may be at risk of hurting themselves or other people. So there are residential facilities or hospital stays, things like that, where they actually stay overnight to receive care. And kind of middle ground to both of those would be outpatient therapy. For those who are younger, there's play therapy, sand tray therapy, a lot of different modalities that people can use with youth.
I was thinking too, for outpatient, just so that people understand that there's different things that can be offered outpatient. So usually for kids and for adults and adolescents, it's individual therapy can be offered, joint therapy, so with the child and the parent through the entire process, family therapy, and group therapy. So all of those things can be offered. Similarly, can be offered the same in inpatient settings, but typically in outpatient. Those are the different ways that services are provided.
Wonderful. Thank you very much for offering that explanation of the different types of services, mental health services for youth and adolescents, and giving those examples of what those different treatment modalities can look like when those services are probably being explored. One area that kind of came about in the planning of this conversation was talking about the quality of mental health services, particularly for youth, and wanted to pose this question, what should caregivers expect from mental health services in terms of seeking quality services? What should caregivers expect from quality mental health services?
Well, so I think, one thing to look for quality services, again, it's going to depend on, first of all, which level or what type of services that the youth is receiving. But you want to make sure that it's a therapist who's a good fit for your child. There are a lot of different types of therapists out there. And so if they're not able to meet your child where they are, whether it's in terms of their psychological needs, whether it's in terms of their culture, any of those things, if they're not able to connect with the child and the family that way, then I encourage you to keep looking and try other therapists, because that therapeutic relationship and the rapport is central to the results of that therapeutic relationship.
I think you always want to ask too about the training and background. So whoever's the treatment provider should be able to explain really clearly what the training is, and making sure that it is, the type of service that your family needs or that your child needs. And I think word of mouth is always a really good thing, like just to check with other people if they have received services from a certain place, because that goes a long way just to better understand, I think, how things really do play out, when the provider is working with the family. And asking if there's any sort of references, places where you can look at just to see about the services and what people have said about the services. I would recommend doing that as well.
To piggyback off what both of them just said, I know for me as a caregiver, the main thing with me, and it took a lot of trial and error, was just basically finding someone that fit, you know, my child's and my family's individual needs. And we went through a few, and it wasn't until maybe about 4 years ago that I realized that it was nothing wrong with the counselors that my son had previously, but it was like for his needs and what I felt that he was lacking and what I couldn't give him, and realizing what he responded to, it was in my best efforts and interest to keep pushing for him to have a Black male counselor. He was lacking a relationship with his dad. And it's like, I can do all I can. His therapist, she tries to do everything she could, but that's that one piece that he was missing. And it's like, ever since I got that counselor for him, it made a tremendous difference in our lives. My son, he opened up more, and this is the one who has autism, and he's mainly nonverbal. His vocabulary started increasing. He became more outspoken, and even advocating for himself. So it's like Natalie and Lisa said, just basically, knowing what fits your family.
Absolutely. That's good information. I think that is very helpful for those who are listening in with us this evening about understanding what quality mental health services is. And I'm not even sure if I probably should have started off with that question. Maybe offering an idea of what quality mental health services look like, and then again what caregivers expect. But that, I think what you all offer is really helpful with helping us understand that we want to seek quality mental health services, and one way to go about doing that, as Lisa said, is asking around, maybe your neighbors, your friends, other individuals who may have been connected to services to get good referrals. Just kind of recapping what I heard, understanding that you have to find a therapist that meets your individual needs. That therapeutic rapport and relationship building is really important. That you sometimes have to do your research and to find the best fit for the child and the child's needs. As you were just saying, Tamika, I think that's great. And I just wanted to add on to that question, still in the vein of quality mental health services. I think we spoke from I think one of the levels you mentioned, Natalie, about like the outpatient. What would that look like for the community-based services, quality mental health services for community-based mental health services?
So from my experience working in community health, it was more like community health served as a linkage to outpatient therapy. And my role as an intensive in-home counselor, I went into the home and I did interventions there. But if the child also wanted a specialized therapist to work with them, I helped them look at profiles and select someone. Sometimes I provided transportation to those appointments and provided that collaborative link between the parent and the therapist to make sure that as a team, we all rallied around the child and ensure that the child got what they needed.
Awesome. Thank you. That's really helpful. Would anyone like to add anything else to that question, thinking about what is quality mental health services, what should it look like, and what caregivers should expect?
One other thing I was going to say is I think it's really important for parents to ask for what they need. So sometimes I've heard, this may go into another question you have, but that there's not good communication between the provider and the caregivers. And caregivers are sort of waiting just to hear updates or, how's my child doing? So it's like things are happening they don't know about. Part of the quality provider is that good communication. So really sharing the information as they're going forward. How can the parent help support the child? What kind of work is happening with the therapist? But I think that parents can always ask that question and say, I really am open to hearing good communication all along. Like, I want to know how my child is doing. How can I help? You know, what are the challenges? Do they need other services? I always really appreciate that. And we try very hard at the center where I'm working to always keep the parent centrally, you know, as part of the treatment. But if there's questions along the way, I think ask them. I always encourage parents to ask if they have questions.
Thank you. Thank you for that. This next question I asked really with you, Tamika, in mind, thinking of you as a caregiver, and not to say that she's the only caregiver on the call today, but kind of, you know, representing that role of caregiver, and what that experience might look like when trying to figure out how to obtain mental health services for children. I imagine that that can be a confusing and maybe even frustrating process. And so with that in mind, wanted to maybe talk about what experiences have you found to be the biggest concern or concerns of caregivers when they seek mental health services for their children or youth in their care?
My biggest areas was going back to what Natalie and Lisa said about that part of finding the right therapist. Because a lot of times, you know, depending on what agency you're with, they may not have what you're looking for. So then you may have to go elsewhere, and depending on the relationships that you built with the agency you're already at, that can be extremely difficult. The process in itself is difficult. My son started out with getting intakes done at home, intake assessments done at home from St. Joseph's Villa. And that was specifically based off of his behavior, but it was amazing to see how the mental health tied into his behavior. So for me, the trickiest part was definitely finding someone that was fit for him, because for so long he had therapists that maybe looked like me, looked like my sister. He had all types of therapists, but it was like none of them fit. None of them fit. None of them understood what it was like. They didn't understand the culture, as Natalie spoke on. They didn't understand our culture and some of the things that I did as a parent. I bumped heads with a lot of them also. So to me, it's just finding that it can be a long and tedious process. And sometimes you may even want to give up. I know I wanted to give up a few times because it was too much. Going in, them coming out, the trial periods, making sure, you know, they knew how to handle my son because his behaviors were kind of, you know, severe at one point. So it was a lot. And depending on where your child is at, it can become difficult. You may have someone that comes into your home and you may not agree with some of the things that they're doing. So you're going to bump heads, but that's where that communication, as Lisa was speaking on, comes in at. So I just think finding that right fit has to have been the most tedious and difficult process, because I'll say he started receiving services when he was about 6, and he didn't receive his Black male counselor until he was like 11 or 12, and he's 16 now. So it took about 5 years to find that right fit for my son. So it'll always be different for everybody, but I think just finding that right fit for whatever your child's specific needs are is definitely has been the most difficult thing for me.
Right. And I appreciate that, Tamika. Thank you for sharing. I want to actually pose that same question, but kind of getting an idea from the role of the provider. And based on your experiences, Natalie and Lisa, what have you found to be the biggest concerns of caregivers when they come to seek mental health services for their children?
I was thinking of like right now too. I think one of the biggest barriers is this virtual world, like of telehealth now. And so many providers really don't have availability. So I think accessing services is a very long wait. And I think waiting for the right person. And Tamika, it's so interesting to hear that, and good for you for keeping after it for your son, just to find the right person, because I couldn't agree more with that being the number one. Just a place that somebody feels safe and someone that they feel like they can talk to is the most important. So I think getting people to call them back, we've heard, has been hard. Just even getting in touch with somebody to get services, and then having to wait for those services while your child is really struggling can be very, very hard. And then I just think sometimes scheduling, is really tricky and gets in the way, like the person's not available when you're available. So just like really practical things, and maybe transportation, like they're not in a place that's really easy to get to. Also, if there's insurance that people are using, if they limit the amount of time you can see the therapist, that's also really tough. So I would say those are the main things that we hear about when we're referring out for services.
Something else that I would add that could be a challenge as well is if parents don't understand the therapeutic process as well. Sometimes it can be a point of contention that, I've taken you to therapy twice and I still see these issues, when, the first few sessions are really just building rapport so that you can do the work. And while I earlier said, keep looking until you find that fit, I do encourage you to at least give it a few sessions before you make that decision. But it's kind of intuition in your gut. You'll know if maybe this just needs a little more time, or maybe I do need to move on to someone else. I think parents too, providers should remember to really explain the modality that's being used to the parents. There are a lot of parents with younger children and they're getting play therapy, and the parents like, wait, I'm making time in my schedule to bring my child here to play with you. That makes absolutely no sense. But as a provider, being able to explain that younger children can't just sit and talk, they express themselves through their play, and as we continue to play, we'll see what the needs and the concerns are, and we'll be able to really help this child through this process.
Thank you. That's really helpful. I heard a lot of just really great insight to what these challenges and barriers really look like, and kind of just starting back with what you said, Tamika, finding the right fit. That in itself could really be like one of the biggest or number one challenges when navigating that process. But then I heard that there are some others when we think about, virtual, like today, thinking about what we're experiencing right now is just, it sounds like waiting lists, like long wait lists, that, there's been a lot of new referrals. And so, having to even wait to get a response, navigating services through through the virtual world, transportation, if, still, getting services in person. Then I also heard Lisa mention, we didn't necessarily talk about cost, but when you talk about insurance, some of the, insurance is one of the main resources used to try to cover services. And if there's limitations on that, that can certainly pose a challenge or a barrier to access to treatment. And then kind of going along with what you just said, Natalie, is that the therapeutic process in itself can cause that, can be a place of contention where not understanding what that process really looks like, and encouraging caregivers to give it some time, to be a little patient and allow for, to be open to allow for some time to see how that process works, with still keeping in mind that using your intuition to see whether this still might be the right fit or not. And so that's some really great information to lift up. And that actually went into another question that I already have. And so I just wanted to maybe open that up to see if there were any other barriers barriers or challenges that we know exist for caregivers as they try to navigate mental health systems. And so again, I already heard mentioning of diversity and when it comes to cultural diversity, when it comes to seeking a mental health provider, long wait lists, maybe costs. Would there be any others that you think is important to highlight at this time?
I know for some, it is possibly not even knowing where to start. Unless your child is exhibiting some signs physically, a lot of times you don't know which avenue to go to because for a lot of services there is a referral process. So let's say for instance, like my daughter, hers wasn't related to a diagnosis. It was more so I something ain't right and I can't pinpoint it, but it's like who do I go to? Because she doesn't actually need to go over here. She don't have autism or she's not diagnosed with bipolar or anything else and can't go over here because it's not because of this, but knowing which avenue to start at to kind of get that help because certain diagnoses have certain providers that handles those type of diagnoses. So it was kind of hard for me with my daughter as opposed to my son, where it was so much easy. They had St. Joseph's Villa, they have RBHA, they have all these different places because he had this diagnosis. But for my daughter, she doesn't really have a diagnosis that fits. So it's like, where do I start? So I know that can be a lot. And then that in turn leads to the waiting list and the phone calls back because you don't even know where to start at. You don't even know who to go to.
Right. I can definitely see in that being a challenge when there may not be a specific diagnosis already, given, whether maybe, let's just say that diagnosis was given from a PCP and that then was a referral to a specific type of, program or agency. But if, how we started off the conversation earlier was kind of just offering a definition of mental health. And so when we, if there's a caregiver and you have, their children or child and say, hey, we know something's not right. We know that there's some struggles. We don't really know what it is, but where do I start to find the right type of provider? And so that what I'm hearing you say, Tamika, is where do I start when there may not be a diagnosis known at this time, or there may not necessarily be a major like mental health illness or disorder, but we're needing, there's a need for mental health services to address some challenges, and how do I begin to find the right type of providers for that? So I appreciate you sharing that experience with your daughter to lift up that area that can be a challenge. Any other thoughts as we continue to move through our conversation? One thing that came to my mind was, is shame and stigma still considered a barrier for our families? What are your thoughts on that?
That's actually what I was just about to comment on, the step before what Tamika was describing. Where do I start? It's even should I start? Sometimes there is shame that, or a feeling that I failed as a parent because I now have to go outside of my home and get help for my child. Or if you have certain religious backgrounds, sometimes there's a stigma there in those communities that, you let your higher power handle these things. You don't bring other people into it. So I think all of that plays a role and can be a barrier to reaching out for help.
Absolutely. I would agree with that as well. In thinking of that, kind of staying right there in that vein, Natalie, and this is not just directed towards you, but it's open to anybody, but what type of tips, if you will, or advice, what kind of information would be helpful to provide to caregivers on how to better navigate, the mental health system as we're describing it. Any suggestions that you would offer to kind of help navigating some of these challenges or barriers that were just mentioned?
I would say, just piggybacking off of what Natalie said, that shame portion, I think just really paying attention to your family and what your family needs. And sometimes we have to throw out those stigmas and shames and, generational traditions and just like actually just think about what your family needs. I know for me, for a long time, is what goes on in this house stays in this house. Like that's a known thing. So I always felt that that's where it needed to stay at. What I was dealing with and what I was dealing with my children needed to stay in here. So it's like just paying attention to my children. It was like, hold on, it's no way it can stay in here because I don't know what to do. I don't know what to do by myself. I was a young mother. I didn't know what autism meant. I didn't know the behaviors that came with it. I didn't know any of that. So it's like, how can this possibly stay in this house? I don't know what I'm even doing, and I don't know everything that there is to know. So it was that portion of it, and just understanding that it's okay. It's okay, and it was nothing wrong with me. Like I'm doing the best that I can. And as a parent, piggybacking off what everybody said, sometimes it's that, did I do something wrong? And it's like, no. A part of being a good parent and striving to be better is just saying it's okay. I don't know everything, and I'm willing to take advice. I can remember, I know I'm a good mom, but her and my son tell one of my close friends that I can't talk to my mom. She don't listen. That was hard, but it was like, that's how he really feel. So I think one of the tips is if you have children that are able to speak and they do choose to express their feelings, really take heed because that's going to determine which route you're able to take. Having a child that can speak out and let you know what they're feeling is extra, extra helpful. And that was one of the biggest things that kind of helped with my son is just actually stopping and listen to him now. So just like I said, paying attention to your family's individual needs and kind of like not straying towards that stigma and that something is wrong with you if you need help or want to receive help.
Absolutely. Definitely appreciate you sharing that about, offering those tips or suggestions on how to or what can be done to really kind of help better navigate the systems. And I find it interesting that you really highlighted the word stigma, Tamika, and I'm aware, as I'm a mental health provider myself, that there are stigmas that exist. And I think that, what we're talking about right now is that we know that stigmas exist just about in mental health, right, in general. Like Natalie said, before we ask the question, where do I start? Should I start? Because there's these stigmas that exist. And I'm wondering if it would be helpful to kind of just maybe identify, like name what some of those stigmas might be if we're aware of any. So like, I'm going to probably just say, what are some of the main stigmas that you might, that know exist between families that are seeking support and maybe about the mental health profession or mental health professionals? What are some of those main stigmas that might exist or that do exist?
Well, I can give from a caregiver's standpoint. I know some of the stigmas that I placed against the mental health profession in itself was, you know, they get paid for this. Before I knew it was some who did it, you know, just because this was a passion of theirs, I was like, oh, they get paid for this. All they gonna do is have me sitting there, come in, lay down, and talk. They don't really care about what I'm dealing with. So it's like we don't really know, but from what we've seen or from what we've been told about what therapists actually do and the services that are actually out there, we're led to believe that they don't care. They get paid for this. So why I need to go sit there and talk to them people? They don't understand what I'm going through. That's like that was the biggest thing for me, and I avoided it for so long. Or either it was the other stigma. I ain't going in there and listen to them tell me what's wrong with me. Ain't nothing wrong with me. So like Natalie said about the should I even start? If you're not there and at the point where you're ready to take some self accountability, it's not going to work because it's like ain't nothing wrong with me. This person gonna have me laying in there pouring my heart out about what's wrong with me. They don't care. They don't know what I've been through. They can pay for this. So what's the point?
Mm-hmm. So we know that there are stigmas that exist that, let's just say, you know, caregivers or family members may have about the, you know, mental health professionals or the mental health profession as it is. On the flip side, you know, generally speaking, are there some stigmas that may exist from the mental health profession about caregivers, and you know what might be, you know, what are some stigmas that might exist even from the provider side as it relates to caregivers, kind of just to air it all out, put it out there?
Absolutely. I think to deny their existence would just be dishonest. And so, you know, just like Tamika said, from the caregiver end, they come in with some of these kind of perspectives, and some of the professionals look at it and say, oh, well, here comes a parent that wants me to fix their child, and they don't want to do the work at home and, you know, help this process along and things like that. So it goes back to what we talked about earlier about the importance of communication and collaborating for the good of the child, for a professional not to come across as a know-it-all, but to offer some observations and some suggestions, and then really get on the same page with the parent to see what can be done to help this child, so that it's not, you know, such a clashing of the wheels. It feels more like a team approach.
Absolutely. I appreciate both what you said, Tamika, as well as Natalie. And Natalie, you hit right where I was going to ask is how do we remove, right? How do we work towards removing that stigma between families and mental health professionals? And I think you were spot on with reminding us about the communication, addressing some of those misconceptions that you know, that exists, and education, like you said, the communication and the education, being open to really see how you, like you said, you can work together and what this process really is meant to be and how it can work. Lisa, I don't know if you're on my screen. I didn't know if you wanted to add to that.
I was thinking there's also a lot of stigma sometimes that mental health providers make kids worse, or like it makes the problem bigger. And I want to say that, you know, sometimes that things do get, like, symptoms increase when kids start in treatment because they're really addressing the hard things that they've been through. So to really hang in there through that, because if you're really working through and talking about the hardest things you've ever been through in your life, it's going to make things feel harder and feel more upsetting. So just to sort of understand that that is part of the process, but none of us want to make things harder or make problems bigger or create problems where there's not issues. So a good provider is going to do a very careful assessment and understanding of really what is happening with the child, understanding the strengths, like all the things that are really great, understanding what the challenges are, and then be willing to help with the challenge areas, right? And really playing into the strengths. So I think that's something that I hear often. It's just going to make it worse. We don't really want to, you know, we're not interested in doing that. So we try to explain that to people. And I've also heard families say to me, like, they don't really want somebody up in their business, just Tamika, what you were saying. So like that mental health providers maybe are nosy. Also, I think can be threatening because we do have this responsibility if we know that there's safety involved. So if kids are, harmed to themselves or others, that we have to reach out and get other systems in place. And I think sometimes that feels really threatening. So having people up in their business that may bring other people in that they don't want, involved with their family, sometimes I think gets in the way.
Absolutely. Yeah, those were some really key stigmas too, Lisa. I really appreciate you sharing that. You made me just think as you were talking, kind of going back to a misconception, and you kind of hit on that point about really just explaining to caregivers about that, there oftentimes you might see, like you said, an increase in symptoms, and the reason why that may happen. You made me think about a possible misconception about just that we send our we send our children to get help, but then that's it. We just send them to go get fixed, if you will, and then and then they come back and we expect them to be better. But I like what you said, that it really involves the whole family, that it's not about just sending your child to get fixed, but that there are expectations and the role of the caregiver in the whole treatment process as well. And I think oftentimes that's a misconception, where caregivers may not understand their role in the therapeutic process as well for their child. Would anybody like to add any more thoughts to that?
I would just like to say, parents, you are so important. Caregivers, you are so important. The professionals can't make, substantial progress with your child without you. So even though you may be tired, frustrated, you name it, your role in this process is crucial.
Thank you so much, Natalie. We're getting close to the end of our time together, but wanted to just ask maybe one or two more questions. And I think, Lisa, you actually began hitting on this about when you mentioned when you're looking for quality providers, that you want to make sure that they're doing a really good, thorough assessment. And I thought that spoke to a question that I have about how do we address the concern around misdiagnosing. So kind of related to what Tamika was mentioning earlier about maybe it's hard to seek, or it's hard to figure out where to start with looking for therapists when there's no diagnosis available. But we do know that there is a challenge around misdiagnosing sometimes, and how that might oftentimes lead to overprescribing. And so wanted to just ask the question, how can caregivers advocate on behalf of their children for more accurate diagnosing, is part A of that question. And how does overprescribing medication come into play with this scenario?
You can go ahead, Lisa.
No, you go, please.
Oh, okay. From the caregiver's perspective, I've been through the medication process a few times. The first time it wasn't a misdiagnosis, but sometimes, and a lot of the times, I feel like that's the first thing that after a diagnosis is handed down, they automatically prescribe medication. And in some cases it is needed, but as the parent and caregiver, that's when you step in and kind of, paying attention to your child and knowing your child, and not saying that, sometimes you're not going to need it. But in my case, when I did put my son on medication, I realized that it wasn't needed. So it's not to say that sometimes medication isn't needed, but a lot of the times it's not. And that's just part of the process. But as a parent and caregiver, you really have to advocate and fight. I know with my daughter, it just took me learning her. I didn't know anything about ADHD. So it's like now I'm dealing with this too. So it's like I started her on medication because it was like she couldn't focus in school. But it's like I gotta figure out, I gotta learn my daughter now. Like I know who my child is, but now she has this going on. So I really need to do some research and figure out some other alternative methods as opposed to medication, because medication doesn't work for all children. Sometimes it kind of, increases the behavior, or either I know for my son, he was like a zombie. He was in a zombie state. So it's like the behaviors weren't there anymore, but he was no longer the 11-year-old child that, I'm used to seeing. So it was like, no, I can't do this anymore. So I think if your child does have a diagnosis, learning as much as you can about it so that you can pay attention to the behaviors and things of that nature, and then focus on alternative methods as opposed to the medication. Because if you notice an increase in behavior, increase in dosage. And it's like, that's not necessary all the time. But I think with the work that all of us are doing and our trauma-informed care is coming in, it's a lot of misdiagnosis going on because some of the behaviors are due to the ACEs and trauma that children are experiencing, and it's being misconstrued as they're hyperactive or they have behavior issues, and that's not the case. And I know that's what I'm seeing a lot of now as ACEs and trauma is being brought to the forefront more and more. So just as a caregiver, paying attention to your child so that you can, when you go into those appointments, let them know that, hey, I don't really think it's this, but they just recently experienced this, so it may be contributed to this. So I know as a caregiver, that was my biggest thing, like really paying attention to my children to make sure that it wasn't just something that was going on with them, and was it contributed to something that I did, something that they experienced in the community. It could be a number of things. So just paying attention.
That was so well said. And I think a good assessment includes all of the people who are involved with the child's life as much as it can happen. So getting information from the child, from the parent, from school, if that's appropriate, from other people who were involved. So if there is an intensive in-home provider, outpatient therapist, psychiatrist, really before medication is something that's started. Making sure you have all the information. And I always think of medication too as starting with just a trial. So you're trying it out to see, is this going to make a difference? And usually for several weeks, just to make sure that you're really seeing the full effect. But then advocating very strongly for your child if it's something that's not, just like what you said, Tamika, like if it's not really helping, or it's making things worse, or they really don't seem like themselves anymore, that there's always the choice to make a change. And also like considering using like all natural remedy like stuff instead of prescribed medication. So there is alternative medicines that I think are easier on systems for kids and for adults, so that there's other options out there, and making sure you have someone who can share all those options with you. And I think definitely I work a lot with kids who've experienced traumatic events, and they're commonly diagnosed with ADHD when it really is not ADHD. So they look like they're very distracted. They can't pay attention because there's so much else that's happening within their mind. They can't pay attention. They're processing what they've been through. So it's just a lot of things that need to be considered and carefully assessed. So I think a lot of times when families go to a psychiatrist or a PCP, that's their job, is to prescribe medication. So that really will be their first, go-to. And having an assessment before that medication evaluation starts is an important step.
Awesome. Thank you so much. That was really helpful. That was a lot of information, and I believe that our caregivers, our parents, anyone listening in on this evening is really finding very helpful. And with that, want to kind of just follow up with that question by asking, and this is more of a general question, where can caregivers find support in advocating? So, just, thinking about this work of, a lot of the follow-ups, the phone calls, being in conversations, maybe, seeking those quality services, learning what it looks like to maybe ask for second opinions or other, asking to learn about other treatment options, whatever it may be, as it relates to advocacy. Where can caregivers find support as they continue to advocate or maybe start advocating for the youth in their care?
So I would say a good starting point is your child's pediatrician. Like Tamika talked about her daughter and not knowing what was going on, but something seems a little off. And when you don't know where to start there, because they may then refer you to someone to evaluate her. And that evaluation may lead to a diagnosis or at least more information about which avenue to take, whether she needs like an intensive counselor in the home, whether outpatient may work, that kind of thing. But as a starting point, a pediatrician is a good place. If within your network, other parents who have taken their children for services, use that word of mouth, advocate that way. Teachers in school can be helpful as well if they've noticed anything going on because they spend significant amount of time with your children as well.
You pretty much summed everything up. Those were all of my avenues, and the main thing is, as parent, trust your instinct, trust your gut. With my son, he was 2, and he met those milestones, but something just it's like it stopped. And had I not been paying attention to him, I probably would have missed it. And that led me to taking him to, as Natalie said, the pediatrician and getting a second opinion. And with my daughter, it was school. We've noticed her behavior, like some ain't right. She doesn't have a diagnosis of autism or any of that, but some not really clicking. Some is not right, and that led to an assessment at the pediatrician's office. So, and then just being open-minded and taking suggestions. That was my biggest thing. I couldn't have that, oh, you can't tell me nothing about my child attitude, because that wouldn't have benefited me or my child. But, if you have your child in any type of programs or somebody that's around them on a daily basis and they come to you with any kind of concerns, and if you know this person is a genuine person and y'all have a good relationship, hear them out, because you can miss, as a parent, you can miss a lot of things. I know with me, I have 4 children, so it's kind of hard trying to pay attention to every single detail about all of them. So, those trusted friends and counselors and teachers and all of that, just, hey, Tamika, I noticed such and such, and it was from there that I had to take actions and steps. So just pretty much everything Natalie said, just paying attention to your circle.
That is good stuff. Yeah, that's really great. And I really appreciate you, Natalie, and Tamika, and Lisa, and all that you really shared and offered on today. I think this was a very powerful conversation. And before we close and I hand it off to Tamika for our closing, I just wanted to ask one final question, and that's an open question to anyone who would like to share. What facts would you like caregivers to take away or leave with from this conversation today? What are some cold facts that you would like caregivers to leave with from this conversation today?
It was stated, but just, letting them know that they are important. They are probably going to be the most important factor in the type of services that their children or the children that they care for are going to receive. Their voice is going to be that number one factor, because a lot of the times either the child has been through something, they could be nonverbal, it could be a number of different details, but having that caregiver communicate and just being open and letting them know that, hey, this is what my child needs, that's like the biggest, that's going to be the best and biggest determining factor in the quality of care that your child will receive.
I was going to say almost exactly the same exact thing, that the number one healing factor for kids is having one caring adult. So that caregiver importance is just amazing. The caregiver is the one that's going to be there for the rest of their life, right? We're the treatment provider is here for such a short period of time. So we're really here to help assess, give tools, give recommendations, work with the kid and the family. And then the parent, has it from there. So it's a big responsibility. I say that as a parent myself, but a really awesome one too, an amazing one, to be able to be there for your child. So definitely that the caregivers are the number one healing factor.
And I would just like to encourage you all to try your best to take the stigma off of mental health. Those who receive mental health treatment, it does not mean that you're crazy. What does a mental health patient look like? We don't have an answer to that. If you went to a store today, you probably walked by at least 3 or 4 people who are receiving treatment to some level. Free yourself from the shame and just do what you need to do to promote your health, your child's health, and go forward.
Ashe to that. Tamika, it is in your hands.
I just want to thank everyone again for tuning in. Natalie and Lisa, thank you guys so much. It is a blessing and it's exciting to work with you guys every day. Your wealth of knowledge on this topic was one of the reasons that I reached out to you guys specifically. But as I stated earlier, mental health is just a big topic for me. It's one I hold near and dear to my heart. I honestly feel like more people, as Natalie stated, should take the stigma off. And if you feel like anything is off with yourself and your children, it's nothing wrong with receiving help. I know once I did it, and I still receive therapy, it was the best thing I could have ever did. It's helped me in being a mom, friend, advocate, community member, all of the above. So thank you guys so much for this. And we will be back in 2 weeks for the last conversation of the year, and it will be on self-advocacy. So see you guys then. Thank you.